Good afternoon, everybody. A happy new year. Welcome to our virtual open house. I'm Brooke Lovelace. I'm the Executive Director of the Iowa Developmental Disabilities Council. I want to give a good thank you to our legislators that are here today to learn a little bit more about the issues that are affecting people with disabilities. I know your time is very valuable as you prepare for the 2025 session, so we do appreciate your commitment to being here today. It's really hard for us to believe that the session starts next week already, but here we are. So also here with us today are our DD Council members and our public policy members who live throughout the state of Iowa, and they represent people with disabilities and family members. We don't have time to do introductions for everyone today, so I'm going to ask that our members of our DD Council and our members of our Public Policy Committee to put their names in the chat and where they're from, so our legislators can see who is all here with us today. In addition to that, we also have advocates and family members with lived experience, and they're here today to share their story, and we appreciate them working together with us as we meet with you today. We do recognize that there may be a few new legislators with us here today that may not be as familiar with our DD Council. We don't really have time to talk today about all the things that we do, but if you did have a chance to review our priorities as we speak today, you can see that DD Council really wants to make our communities better places for people with disabilities, and we want to do that alongside with our legislators. If you would, though, like to take a deeper dive into what the DD Council does, and more importantly, what we can do to help you as you navigate through bills and policies that might be affecting people with disabilities, we'd be happy to meet one-on-one with you guys during session or even after session. So please just reach out. Carlin Crow, who's our public policy manager, is going to be leading today's discussion. But before we turn it over to her, I want to allow Brady Werger, who's our chair of the council, to say a few words. So we'll turn it over to him. Again, thanks for being here, and we look forward to working with you guys this session.
Hello, everybody. My name is Brady Werger. I am currently the chair for the Iowa DD Council. I want to welcome all of you a happy new year. 2024 brought a lot of good things for our council. We worked on a lot of good things, and I feel like we got a lot of good stuff accomplished. So now that we are starting the year of 2025, I really hope that will continue. I know it will, but it will continue because of the tremendous support from our council members. We couldn't do it without you. We couldn't do it without our representatives and senators either. So being able to have you guys here today to listen to our stories truly makes me believe that it helps you guys understand what those issues are here in Iowa, not just in Iowa, but in the United States, and how we can make lives better for people with disabilities. So once again, I want to welcome everybody for attending today. I hope you guys find this meeting very, I hope you find information that can help you to make changes in the year of 2025. So that's all I have to say. And Brooke, am I handing it over to Carlin or you?
You are, Brady. Carlin's up.
All right, Carlin, you have the floor.
Thanks, Brady and Brooke, and I'm up, I guess. So I'll welcome everybody also, and thank you for being here today. As Brooke mentioned, we have people joining from all over the state. So since I know it's cold wherever we all are today, it's kind of nice to be meeting virtually, even though it would also be nice to be seeing all your faces and talking in person, but sometimes it just works out better this way. And we'll be able to do that, hopefully, with all of you during the session. Our legislative reception is coming up at the end of January, and we'll talk about that at the end of our presentation today. So today we're here to talk about our public policy priorities, introduce you maybe to some new ideas and issues that we would like to work on, and also introduce you to some people who have stories to tell about their circumstances and why we've identified some needs around the state that we think could be helped or alleviated with some policy change, and would like to make some of those suggestions today. And they're also here to educate all of us on what those needs are and some potential solutions. So in addition to me kind of doing an overview here, members of our public policy committee, who are all council members and also members of various communities around the state, will be helping introduce our priorities. And then we have stories that are being told by by self-advocates and advocates under kind of each section of our priorities. So we've broken our priority document, which is online, and we'll show you the link to that here soon, but you might have all got it attached in your invitation. We've broken it down into employment, education, and community living and healthcare, and also voting. So at least for 3 of these sections today, we have people with us to, again, talk about their stories and what's happening in their communities. So, and then we've also invited a couple of legislators to make comment about some bills that they had initiated last session, and even the session before that, that we're continuing to work on, and appreciate their work on addressing some of the concerns that we have brought up in the past and are bringing up again today. So we'll have them comment specifically on those bills and legislation at the end, but also open it up for any of you, any legislators who would like to make comments, provide us some suggestions, or any outlook you see for or any questions that you might have on some of these issues, or outlook of what's to come this session. Before I turn it over to Kevin Harris, who's the chair of our Public Policy Committee, I do want to mention that we do have resources available for legislators that are on our website. We will have these in printed versions also that we will be able to provide to you. Excuse me, I'm one of the person that's getting over the crud. And don't quite have all my voice back. There it is. So we produce every General Assembly, we produce the guide to the legislature, which in the past has looked like this. If you can see my picture, we've changed up the cover a little bit, and we've included information about Congress and the federal level, and we're calling it Who Represents You, and it's still a guide to the legislature and Congress. Amy Campbell, who we work with, is working hard on getting that updated and produced, and we really appreciate her efforts because a lot goes into that document. It's 80 pages this year, and there's a profile of every legislator and every member of Congress from Iowa, and also how you navigate the process of legislation. So that's for our advocates to use as a guidebook also. Last year, we produced a bill of the week every week that was specifically a bill. This session, we also might be producing these handouts that deal with an issue, and maybe not a bill has not been introduced yet. But the idea here is that we look at a bill that is going to have an impact on people with disabilities, and we talk about what that impact might be, some data and some facts and figures, and then we provide a story that might be helpful for how this could impact somebody with disabilities in Iowa. We're going to be doing that again this session and providing it every Monday. We'll provide a bill of the week and an analysis. So I hope you'll be looking forward to that and helping us with any feedback too on the impact on Iowans, which is what we really want to emphasize there, the impact on Iowans with disabilities. And then we also produce one-pagers that are maybe specific to one topic or issue. And we also, this one is about employment, which is kind of our top priority this year. But we also encourage the groups that we host at the Capitol. We have groups that we help get to the Capitol, come to speak to their legislators, and talk about the issues that are important for them. We also encourage them to develop one-pagers and leave behinds so that you all have additional information when you're talking to them and when they leave or talk about an issue. So we help them design some of those also. And then our priority publication, just to give a high level overview here, so you understand how we laid out things for the presentation also today. Each section talks about the issue. So in this case, employment. We have a goal for employment and then some rationale about why we're working on these particular issues, and then some calls to action. And this one happens to have lots of calls to action. And some of them, I know it's hard to expect all of them to be addressed, but maybe it's a nice little laundry list of what could be done and what could be accomplished to help make change. And then this year in our priorities, we also included some definitions of key terms because we throw around a lot of acronyms and terminology that we use in the disability community with policy, but not everybody knows what this terminology is. So hopefully that's helpful to everyone that's working on these issues who may not, especially those who may not always be working on them. And then again, with each issue, we have particular people with lived experience who are sharing their experiences. And for employment, we have lots of people who are speaking on this issue. For this particular publication, we had 4 people profiled, and you'll be hearing from 2 of them today. And then also they will be coming to the Capitol regularly to talk about their employment issues and things that they would like to see change to help more people with disabilities work. Excuse me again. Good timing for me to turn this over to Kevin Harris, our public policy chair, who's going to start off by talking about our employment issues. And here's another way that we have listed our issues too, and this is listed in our priorities, which you can find online. So Kevin, take it away so I can rest my voice. Thank you.
Sounds good. That sounds good. All right. So we're going to start about talking about employment. So it's an important issue that many people with disabilities in Iowa face. Iowans with disabilities want to work. They want to contribute to society. They want to achieve financial independence just like anyone else. But unfortunately, there are significant barriers to make make it incredibly difficult to do so. One of the biggest challenges is the tough choice when forced to make the decision between pursuing employment opportunities and accessing the support and care that you need to live in a community. To retain healthcare insurance and long-term supports to Medicaid, individuals with disabilities face strict income and asset caps. These limitations trap folks in poverty, limit their ability to work full-time, and even discourage them from getting married or pursuing better opportunities. Instead, forced to rely on public assistance just to get by. Go to the next slide. All right, we're going to do a couple key terms here. And just as Carlin said, I mean, I work in an industry where we have lots of terms, and sometimes it's hard to keep up with terms that you're using on a day-to-day basis. So I like to make sure we define those. So two key terms, and one is employment first. A national plan focused on the idea that everyone, including those with significant disabilities, can fully take part in regular jobs. This plan encourages publicly funded systems to make sure that their rules, policies, and payment methods support competitive integrated employment, or CIE. We're going to get to that in a second. As the main option on public money for employment services for those with significant disabilities. So now we're going to talk about competitive, I can't even quite say it, competitive integrated employment. Work that is performed on full or part-time basis, where the individual is paid either at or above minimum wage, and paid at a similar rate paid by the employer to other employees without disabilities, performing those similar duties. Also with similar training and experience. Receiving the same level of benefits, that's very key, as those to other employees without disabilities in similar positions, and at a location where the employee interacts with other individuals without disabilities. And finally, offered opportunities and promotions similar to those of other employees without disabilities in similar positions. So we're going to go into our call to action on the next slide. All right. So our calls to action, actually, it's not just one to call, it's a plural, calls to action. Implement employment first. So remember, employment first. It's the idea that everyone can work, even those with significant disabilities. So implement employment first policies that prioritize competitive integrated employment. So pay and benefits above minimum wage and equal to peers. For Iowans with disabilities who access publicly funded programs. To do that, removing or steps to the individual calls, I guess, to do that is remove the Medicaid and Supplemental Security or SSI income and asset limits for employed persons with disabilities, whose only option for health insurance, where Medicaid is their only option for health insurance and supports is Medicaid, I should say. We exclude the individual assets such as retirement accounts or the 529 education savings plans from asset limitations. Allow individuals to pay a premium based on their annual income to maintain Medicaid services, sort of a cost sharing model. Provide tax incentives to companies that hire, provide transportation to work, and allow work from home options for people with disabilities. The next, going on to the second column there, fund vocational rehabilitation programs. So through IVRS and the Department for the Blind that focus on the transition to employment at a level that maximizes the federal match so that Iowa can invest in employing people with more people with disabilities. So with the funding that we have currently at the state level, if we raise that to meet the federal match, we can bring in more funds to the state and then use those funds to promote and increase those disabilities in the workforce. Invest in the self-employment program through the vocational rehab, as well as small business and workforce development programs, and incentivize people with disabilities to start their own businesses. And then finally, invest in rural broadband and high-speed internet infrastructure so that rural Iowans with disabilities can access employment programs and work from home. All the more important, considering the last 5 years, so much work has shifted to remote work. It opens up the potential for a large amount of opportunities for individuals with disabilities, but they have to have that infrastructure support in order to achieve that. All right, let's go on to the next slide. And I'm going to introduce our first speaker here. First up, we have Alex Waters from Sioux City. Alex is a quadriplegic.
Oh, please don't. You don't have to read the intro, buddy.
You don't want me to read it to you?
I'll go through that, and they will have it in their handout. So,
well, I would be happy to. So, then I'll just turn it over to you, Alex. How about that?
All right, that sounds great.
Thank you.
I really appreciate the opportunity to be here today, not only for those that are participating currently, but also those that will watch this in the future. I appreciate your time and your willingness to do so. My name is Alex Waters. I'm joining you from Sioux City over on the west coast of Iowa, and I'm excited to be here. I'm thankful it's virtual, so I didn't have to make the long trek down to Des Moines, but I look forward to doing so throughout the session. I wanted to talk a little bit about the barriers before me with employment, but first I want to take you through my story. I had an accident when I was 18 years old, 2 weeks into my freshman year at Morningside, that left me a C5, C6 quadriplegic. I do not have full function of my hands. I use a power wheelchair in order to get around. But that didn't deter me. I actually decided to go back to college, get my college degree, go on and get my master's degree, lived in Washington, D.C., tried to advance my career doing everything that I could to be able to get off of services and be a full functioning member of society, as much of anyone would want to do. And after I felt that I achieved that dream, I had received my first full-time job. I was excited. I was earning a living wage. I was able to get off of SSI and SSDI, but I found out that Medicaid is the only way for me to be able to pay for my care in order to get out of bed in the morning and to go to bed at night. We have those caregivers to thank that I'm able to wear a shirt in this virtual meeting before all of you today. That was a joke. Of course, I'm wearing my shirt. But that being said, my private insurance, although I have great private insurance, they are never covering it because it's what they call continual care or services that continue, and they deny that coverage, and so it falls to Medicaid. You see, after I received my first job, my next one is one now that I've been in 13 years, just about. It's at Morningside University. I'm the director of alumni engagement. And in Sioux City, I also serve on the city council. I was elected for a couple terms now here, serving the fourth largest city in Iowa. But the unfortunate part about this is if I want to keep those benefits, the ability to get in and out of bed every morning, those caregivers, it's essential that I have Medicaid. However, every year I have to go through the renewal process for Medicaid to make sure that I'm within my income limitations. And every year I hold my breath to see if I'm there. The truth is I've been at that ceiling every year for a number of years. I cannot advance my career any further. I can't take raises. I can't go to a different job that would pay me more. I can't get a larger house. I can't upgrade different things. I can't do the things that anyone trying to make a full living would want to do. I can't even get married without those things coming against me. I just want to be a functioning member. I want to pay more in taxes. I want to get a better job. I want to stay employed. But unfortunately, I'm at risk of losing these things because of the limitations placed on Medicaid. So I'm asking you to look at those calls to action and think about me. Think about stories of Iowans all over the state like me that want to work and meet our workforce challenges, but are unable to or too afraid to join the workforce because they would lose their access to benefits. So I thank you so much and take care.
All right, thank you. I love that you said you're on the West Coast. I often refer to Sioux City and the West Coast. I work with somebody up there, so just always kind of funny. All right, well, next up we have Christine Graves. Christine, do you want to go through your introduction, or I'm happy to introduce you as well?
I can introduce myself.
Okay, sounds
okay.
great. I'll turn it over to you.
Apparently, I'm having internet issues, so it may cut off once in a while. I'm Christine. I go by Chris. I live in Des Moines now. I lived in Iowa City for 25 years and grew up in South Dakota. I have depression and anxiety and other mental health conditions. I've dealt with my whole life. And I also think of people like me who may not, we have an invisible disability where you can't see, but we live on Medicaid or Medicare and Social Security, and we want to get a job, and we finally get to that point where we can get a part-time job. I got a job on the Iowa Warm Line in 2001. Wait, no, 2021, 21. And as and when I got that job, I was utilizing services like supported community living, which is like HAB services, where someone could come into my home and take me grocery shopping, or we work on coping skills to help me get through daily life, or I learned how to cook and stuff like that. And I had those, and I was also going to like I had program for habilitation program for people with mental illness. So I get this job, and overnight, pretty much, they said, well, I lost my services, my habilitation and my SCL services, and it's just like, well, you got this job now, so we're gonna take away your services that got you there. So there were many times I had to think about, do I want this job or do I want the services? And um, I I'm not on Medicaid or Medicare anymore, but I had to make that choice to not do it, to go farther. And I'm different than Alex because he had to stay on, Medicare, Medicaid, whatever. But because I have mental illness, I didn't need to stay on Medicare or Medicaid, but I do need it because my private insurance won't pay for the SCL or the habilitation or anything besides a therapist or psychiatrist. And that's very limited too. And I struggle by getting on daily life. I struggle so much more than when I was getting Medicare, Medicaid, because I don't have those extra services that I could get. And if I want them not to pay for them out of pocket, I can't afford that, So I also want you to think about this calls to action. And think of people like me who you may not be able to see our disability, but we need their services to get by in daily life. Thank you.
No, thank you very much. Appreciate you sharing your story. Next we're going to transition to education. So Rob, I'm going to toss it over to you.
Oh yeah, thank you.
So I think I'm back on. I can introduce you too, Rob.
Okay, sounds great.
Actually, we had Emma Boza who's a member of our Council on Public Policy Committee, and I know some of you have met her. And she's a special education educator, was going to talk about her education goal today, but guess what she's doing? She's educating. She had an influx of students today that she needed to help around lunchtime. So unfortunately, she couldn't join us. So I'll give a overview here and then turn it over to Rob for a very specific issue that we're talking about today. But under the umbrella of education, our goal is kind of high level, where we want to make sure that students who are on IEPs and 504 plans and all students are getting the resources that they need in order to have a good quality education. And the number of students on those programs is rising every year. It's a record number. Last year, we don't have the numbers yet for this school year, but 68,187 students last school year were either on an IEP or a 504 plan. And so while those numbers are increasing, funding continues to go down. And that was true last year, even though there was a lot of talk about no cuts to special education. There have been cuts for the last several years. So we know some students are not getting the services that they need. We know some school districts are suffering. And this year, because of the passage of the AEA bill last year, we're just doing a lot of listening and trying to emphasize the point that funding is still not there where it needs to be in schools and classrooms, and especially for special education services. Also the change in how private schools are funded, or private school students get funding now too, has changed some of these dynamics also, and is causing some strains on school districts. So we're doing a lot of listening this year to our people across the state who tell us about what's happening in their school system or to their students, and just gathering a lot of input that we can share with policymakers and lawmakers, and especially as budget concerns come up and are starting to be discussed, we can talk about some special instances of that. So that's the big picture issue. One of the specific issues that we have worked on the last couple of years is, and a program area that we work on, is the transition from high school to secondary school, or to a job or employment, hopefully, and what that time frame looks like. It's a very complicated and scary time for parents, and for also for educators, to move students who are have disabilities or in special education into something that they'll be able to do to fulfill their life goals and dreams and use their skills. So one of the programs that we have been working to support are comprehensive transition programs. And to look at the key terminology here, what these programs are they can be degree programs, but they're usually a certificate or non-degree program in an institution of higher learning, where other students, traditional students, are also getting educated. And it's a program for students with developmental disabilities, intellectual disabilities, or learning disabilities to be able to access an education, a post-secondary education, and learn vocational and independent living skills through these programs. And right now there are 3 in Iowa, one at the University of Iowa, the REACH program, which we have focused on a lot, a new program at NIAC, North Iowa Area Community College, up in Mason City, and then the next program at Northwestern College in Orange City. And it's kind of interesting and nice that we have a public school, a private school, and a community college that all three have one of these programs. And what we are trying to emphasize is the success of students who are coming through these programs into getting into independent living and employment, and advocating for some additional funding so that more students can access these programs, because they're expensive and there's not a lot of enough support to be inclusive to all types of students because of the cost. So one of the programs that we want to talk about today is the next program at Northwestern. The girl who is featured in our public policy priority document is Grace. She's a graduate of the program, and she was not able to be with us today, but John Menning, who's the director, was able to be with us. And then Rob Roseboom, who's on our council and also lives up in the area. And so does Emma. So we would have had good representation from Northwest Iowa today, especially with Alex being on too today. Are all familiar with Northwestern, and Rob is an alumni. And Rob's going to talk about his experience a little bit with the next program, and then turn it over to John. So I'll turn it over to you, Rob.
Thanks, Carlin. Is my internet working? Can you hear me all right? It was unstable for a bit. Thanks to everybody that's joining the meeting today. Thank you for the opportunity. I am similar to Alex. I am employed. I run a nonprofit. I have for 23 years. I actually graduated from Northwestern, which Carlin shared. I am an alumni. Had the opportunity, I think it was a year ago or so, I had some students call me and ask me about the accessibility at the college. So I went in, I told them part of my story, told them about my experience. I thought it was that was the end of it. Fast forward about a year, I think it was this fall, I was invited to be a part of a panel where they were discussing this, and I actually got to learn about the REACH program and what is going on at Northwestern, and got to go in and was very inspired because the students kind of took it upon themselves, from what I understand, to put a panel together to then educate not only the public in our area, but then also faculty from Northwestern, just about some of the issues, both from physical disabilities, but also intellectual disabilities at the university. And I found it very, very inspiring to have students share Grace's story, help me understand the next program at Northwestern, and to realize that they want to continue to move forward and make things better for individuals. And then also find out a few of the areas maybe where physical limitations still stand in the disability world at Northwestern College. And so it was a lot of fun to be a part of, to learn about. And I am just grateful that there is a program like this so close to home, that individuals can go on after high school to be a part of higher education. And so, John, you're way more involved in this program. I just had a little small invitation to it at the panel and was just really inspired by what's happening. And so I'd love for you to share more about the program and what is going on through the next program.
Thank you, Rob. I have a little bit of Carlin's disease, and have not had a good voice recently, but I'll do my best. Yeah, our program's been in existence since 2016, and we started with one student, and we've had any number of students since then, up to 13. We have 11 right now. And yeah, I know many of you are familiar with the REACH program. They've come to Des Moines and talked to you about their program, their issues, their need, their funding, and we have the same thing going here. There are over 420,000 students across the country with disabilities that could go to programs like ours but do not. Only 2% do, which is about 8,400. So there's more than 320 programs across our country that provide and do what we try to do here in Iowa with the 3 CTP programs that were mentioned. So I've just found out that our program's a 2-year program. I found out that our students, they thrive here. They gain confidence to go on and make something of their lives. Um, Grace is a great example. She came here the first weekend she came here, she was overwhelmed and wanted to take a gap year right away. It was too much. And then within a few hours of being surrounded by peers who encouraged her, she never looked back and became a paraeducator, working in Kenzie Elementary and Sioux Center. And she has her own apartment. She's doing well. They love her. She loves them. And it's a great story. She has thrived there. And like her, we have other students that have graduated from our program doing other jobs as well. We have a CNA track that we use, and we have one student that's been doing that for the last 4 years, and she's their best one up in Minneapolis, in Minnesota, and in Mountain Lake. We have other students who have been paraeducators as well. Taylor graduated in 2020 or 2021, and she's a para in Waterloo District and doing well. And another student is in Sioux Falls District as a para. We have one student that graduated. He's working for Vogel's, the Diamond Vogel company here in town. He has his own apartment. His parents are thrilled that he's on his own, and he's actually making more money than me. So I'm in the wrong field right now. And so these are just a snippet of stories of students who have made it in programs like ours that provide the abilities, the means, the tools they need to make it on their own, because it's probably one of the first times they've been surrounded by peers who are adults that treat them with the dignity and the respect that they've always deserved. And it's wonderful to see. They love it here. They don't want to leave. They graduate after 2 years. We do have a 3rd-year option that some have opted to take, and it's just a good investment in them if there's funding available. When they're done, they don't always have the means to pay it back, like a traditional student would. Becoming a teacher, getting an accounting degree, or going into biology or something like that. So to pay back the cost, which is around 25,000 or more for many other programs, ours is quite low, but we try to keep it that way so it's not such a burden. But I know many of them cost much more than that, more than twice that. And for them to pay that back is huge. And more would be able to come, I think, if there was funding available. I have one student that is not returning right now because she can't afford the next semester. So we're trying to work something out, but money's hard for them, and they don't have the means to pay it. So investing in the students for Iowa, I think it's a great investment, and I wish something more could be done. They have so much potential, and we try to pull that out of them and give them the confidence that they can do anything when they graduate, and go home to their homes, their home districts. So many want to stay here, so we try to find them jobs here. but most do go back, and we want to have them be able to succeed with the tools we've given them. And so it's a journey. It's been fun, but yeah, the more support we could have financially from the state would be wonderful. We want them to, we don't want them to not come because they can't afford it. Uh, we want to finish the job that has been up through 12th grade. They've been funded through the program. They've had paras, they've had support all through their years. This is just a great setting. I can't think of a better setting to give them to transition into life and to be independent. Because yes, here they are experiencing life to the full, and it's fun to see them. The REACH program's awesome. They have a huge staff. They have so many opportunities there as well. And the NIAC program that just started is doing well, and it can only continue. There should be more. We want to get the word out. We want to have others try it, and so that the opportunities exist for more and more students to experience this. So that's kind of where I'm at. That's my story. Thank you for listening, and yeah, hope you can see the importance of investing in the future of these students. Thank you.
Thank you, John. And thank you, Rob, too, for the introduction. I'm going to turn it over now to Wendy Anderson, who's going to talk us through the community living and healthcare priority. And I will share my screen again. Go ahead, Wendy.
Thanks, Carlin. I am from Trainer, Iowa, so representing the southwest side of the state. And for that, thank you all for being here. So community living in healthcare, the goal is that Iowans with disabilities have the support, the healthcare they need to live in the community setting of their choice. I always like to say we want to live, work, and play where we all want to. And so that's the goal here too. Home and community-based services, as you may or may not know, support the individuals where they're living rather than an institution. Many of the state-funded institutions are closing, and the opportunities and places to live are just not able to keep up with the demand, as well as the direct support workers. The low reimbursement rates for the employees, the low pay, and there's just a very large staffing shortage for these facilities. And so the options end up being nursing facilities or other institutions may be the only options that someone may have. Also, many healthcare, specifically dental, eye, medical equipment providers have stopped taking Medicaid, and it can be very challenging to provide them or to find a provider because the reimbursement rates are too low and or they're just not paid on a timely basis. I hear that quite often from people. And so individuals aren't able to get the care that they need because there aren't any providers around in these communities. So some calls to action to really consider and think about increasing reimbursement rates to at least $20 an hour without reducing services or hours. And you can see on the right-hand side, it talks about direct support professionals are the ones who provide the services ranging from supports in the living, any of the employees. And I did like to point out this story that where this one of the agencies increased their starting wage by 4.1% to $15.25 an hour, which is higher, and they have 700 DSPs, and they're still struggling to find workers for their agencies to help their individuals. So it's really important that we're able to increase the wages. The next one is to provide tax incentives for student debt relief for individuals who are DSPs to help them in any way that we can. Eliminating the waiver wait lists so that individuals can learn, live, work, play, work in the environment and in their communities. Fully funding the home community-based services and the waiver redesign that's going on, as well as eliminating the barriers to that ID intellectual disability diagnosis that comes along with that. So, oops, Carlin, it changed back, but I have mine here. Sorry. Yeah. And then increasing the number of providers throughout the state will be extremely helpful to everyone. So next is Stacy Ring is going to be up. She here is in Southwest Iowa. With me also, I've known Stacy and her son Alex for several years now. And the only thing I can really say about Stacy, I adore her, but her story tells who she is, and that she's not afraid to go after for what's right and go all the way to the top. So Stacy, I'm going to let you share about you and Alex.
Thank you. I am Stacy Ring, and I'm thankful to be here because I think that our story is like a lot of other families. So I hope that it helps you to hear from us today. My son Alex is 19, and we live in Council Bluffs. He's been on the intellectual disabilities waiver for most of his life due to his diagnoses of autism and moderate intellectual disability. And our experience fighting for services, not only in healthcare, but in commercial insurance and Medicaid systems and just about everywhere else, is really very similar to a lot of families like ours who are caring for a loved one who has a chronic and extensive support need. What's unique to our situation, though, is my career, because I've worked for 31 years in behavioral health treatment and rehabilitation services, and I've successfully obtained services just like the ones we're trying to get for our son for hundreds of people over the years. I also know the vulnerabilities of individuals like my son, and I and the rest of my family are committed to his safety, health, and well-being. In October of 2023, Alex turned 18, and we had been planning for this transition into adulthood for many years because in the IEP system, the Individualized Education Plan system, starting when students are about 14, they develop a transition plan for what they and their families want their life to look like after graduation. And even though Alex is nonverbal, he'd used his communication device to tell his teacher consistently over those high school years that he wanted to remain living at home with his family. And that's what we wanted too. So we wanted that for the consistency and safety needs that he requires. And also I know the realities from my professional and personal experiences that individuals like my son, especially those who are nonverbal, are very vulnerable in out-of-home placements. They're very likely to experience mistreatment, physical and financial, as well as sexual and other forms of abuse, as well as just outright neglect. So as part of our planning for Alex turning 18, his case manager through his managed care company and I had been planning to request the maximum number of service units that he would be eligible for so that he could stay home and we could have providers to meet his care needs in our home. Because of his unique needs, there really aren't very many caregivers that have the skills to take care of him. So it was going to be me. And really what we got was a lot of opposition from the managed care company right from the initial request. We were denied, even though his needs were very clear. We appealed and provided an outline of all of the things that I was doing to help and support him every single day, which was 7.75 hours even on school days and more on the weekends and school breaks. And they still denied us. So after 2 denials, we had to appeal to the administrative law judge. And we did that. I got documentation from all 5 of his medical and rehabilitation treatment providers and presented that to the judge. And not only did she award the full amount of hours we had initially requested, but she rejected the managed care company's argument, in her words, that the administrative rules mean to deny such services when it is a family member providing that care. And she further stated that I had applied to be his SCL provider so that I could provide meaningful and consistent skill building, safety, and self-care regimens that are exactly what the SCL program is intended to do. To get this, the process to get these services approved for my son took about 6 months. By contrast, he was awarded SSI benefits through Social Security in less than 48 hours. Had I been a for-profit agency requesting these services for him in an out-of-home placement, the services would have been approved immediately, and the cost to the state of Iowa Medicaid system would have been about $3,000 a month more every month for the rest of his life. And not every family can provide the services at home, and not every individual like my son wants to remain at home. But for families like ours and children like mine, the system does seem to favor more expensive institutional or out-of-home placements over family placements. And not every family like mine has the time, energy, knowledge, or motivation to sustain the fight to get these services for their loved ones and make this a reality for them. So thank you for having me here today, and I hope my story helps you understand this system a little better.
Thank you, Stacy. And thank you, Wendy, for providing your stories, and Wendy for providing that overview of our priority. I am, let's see, just fielded a text here from Representative Josh Turek, who was supposed to join us today, and it looks like he is delayed, and it looks like he might not be able to. So I'm gonna go quickly over the voting initiative and introduce after that Representative Chad Ingalls to talk about what he's been working on. And I know we're getting short on time. So to go through this one quickly, voting and accessible voting and options for people with disabilities to get to polling places is something that we work hard on monitoring every year. We work with the Secretary of State's office about accessible polling places and how people with disabilities are able to exercise their vote privately and independently. What we've seen over the last couple sessions is changes that are making things harder instead of making things easier. And we saw that this past fall with absentee ballot turnaround time being shorter. There was a lot of confusion and where to turn them in and how to get them. And there's a particular bill that the blind community, the National Federation for the Blind, and others in the blind and low vision communities have been working on to make sure that absentee voting for people who need special ballots because they're blind are again able to exercise their vote privately and independently. So that's something that you're going to see some action on, some introduction on this year. We hope some action, and some of these other issues we're just again hearing from our people who we talk to around the state to get their stories from this past election and turn that into information that legislators can use to make sure that everybody has the right to vote and an accessible polling place or accessible way to vote. So a high level overview of that one. Apologize, I know we're running out of time. I want to make sure Representative Ingalls has some time to share what he's been working on, which relates to education and employment. So I'm going to ask you, Representative Ingalls, if you're ready, and I'll keep track here of Representative Turek and see if he's able to join us.
Well, thank you very much. Just a quick introduction to some of the new legislators and maybe some senators that don't know my background, but I have 2 children with Down syndrome, so some of these issues are pretty close to home. And related to the education piece, the last 3 years we've had a bill in front of the legislature to provide scholarships for students within the comprehensive transition programs earlier at both the REACH and NEXT. We were able to pass those unanimously 2 times out of the House, and then they got kind of held up in the Senate. We'll be going ahead and refiling that bill here this year and hope to make some more progress on it. And I'm open to suggestions and ideas of how we may be able to tweak it a little bit if we need to get it across the finish line. But I think it would provide some great opportunities. And the way it's set up now would be basically a $5,000 scholarship to those students. And what is interesting thing about it, and Voc Rehab was mentioned previously, that what our understanding is at this time that $5,000 could be matched up with Voc Rehab funding and could actually increase the amount of funds that the student would be qualified for. So that's a very interesting piece of it that would be very beneficial for those students. New this year, I'm going to be on HHS and both labor committees, and I have not been previously, so I'm going to hopefully work a little closer with some of these issues. And the labor issue that was brought up earlier is close to home to me too. Our daughter, who is 27 now, employment is a huge desire of hers, and it's been a challenge. And so we're hoping to find ways to either incent employers to provide opportunities for individuals or do some other things to provide, assure that employment is an option and without reducing needed benefits like were mentioned earlier. So that was kind of quick on my part to keep things moving, but.
Thank you. Thank you for all your work on the comprehensive transition programs over the past few years, and for keeping an eye on these issues that are important to this community. We appreciate your support. And thanks for joining today. So it looks like Representative Turek was going to talk about some of the employment related issues that we talked about earlier, but he has been delayed. I'm going to open it up to any other legislators, though, that would like to make comment. I know there's been some chat in the chat, which we appreciate too, but anybody who would like to share what's going on. We're right at 1 o'clock, so we're going to lose our interpreters, but just real quickly, if you have anything that you'd like to add, or open it up to any legislator who would like to make comment or questions.
Well, this is Brett Burke from District 51. I just appreciate you doing this today. It's been informative and look forward to working more with you all. So I can put my email address in the chat box too, so you know how to reach out to me if there's anything that I can do.
Great. Thank you so much for joining. And
Representative from Iowa City. I did have one question, if I might. I know one of the things that I learned a lot about in the interim in like 2023 was about direct care service or direct care professionals and sort of the need for standardized credentialing so that folks can move from one position to another. Is that an ongoing concern? Have there been any discussions? Because I felt like I was asking around about that last session and it just didn't seem to really be on the radar.
I'll let anybody else that might want to chime in, but I can just let you know that there's a discussion about that at the federal level. And nothing has been moving, and who knows what's going to happen with big changes coming this in a couple of weeks. But we have been trying to keep an eye on that also, and I'll take that to the experts I know and see if anything is moving. But thank you for bringing that up, bringing that to our attention.
This is Senator Dave Raleigh. I just want to say thank you as well. Appreciate the information and especially the personalization of the stories. As a legislator, we see a lot of different situations, and I can tell you that I've already run into several, and I'll take this information and work through it. I appreciate it very much, and if I have any questions, I will be asking. Thank you.
Thank you, Senator. Thank you for joining today. Look forward to talking more to all of you.
Hi, this is Representative Mary Madison, and eliminating the barriers to independent living has been, just listening has been very important to me and informative, because sometimes we don't see that services that people are vital are cut out, and then they can't, even though they could do the independent living, they can't all of a sudden. So thank you for hosting this.
Thank you, Representative Madison. Glad to have you.
Carlin, Senator Joan Garrett had a question about the voting turnout for people with disabilities. And the last data that we had on it is that there's still a 10% gap for people with or without disabilities that are at the same voting age or same age able to vote. So that's what we have right now. There's other statistics too, but right now it's about a 10% gap between those that vote with disabilities and those without disabilities, if that helps.
Okay, well, thank you.
Senator Kara Wormy. I'll just echo again with the thank you and appreciating the personal stories. So appreciate you all taking the time to educate us today and look forward to working with you.
Thank you, Senator. Welcome, and thank you for being here.
I wanted to jump back in with just a request of maybe some specific examples of IEP delivery issues at the elementary, secondary levels. If you're while you're listening and collecting those examples.
Okay, awesome. Thank you. We need to let our interpreters go. We're making them work overtime for us. So I think what we're going to do, because Representative Turk is trying to connect and he had some things he wanted to share, we'll close this meeting. But if you want to stay on and have a discussion with Representative Turk, please stay on, and we won't have interpreters for that. We apologize for that. But if you would, again, like to hear what he has to say, he got wires crossed about the time, it looks like, so he was in the car. Did want to mention too, though, that we will have our legislative reception on January 29th, and there will also be a press conference regarding employment for people with disabilities, and then a reception for the Allies in Advocacy, our self-advocate group, who will all be talking about their employment stories. And that's at the State Historical Building that evening. So everything's January 29th. You'll be getting an invitation. I hope you can join us for all of those events. And you'll be able to also enjoy cookies and tacos. So, food motivates. So hope to see you there. And again, thanks everybody for joining today. And we look forward to working with all of you this session. And please feel free to reach out with any additional questions or comments. Thank you.